Hey guys, welcome back to the General Wellness YouTube channel, where today we're talking all about supplements, vitamins, and minerals that you should or maybe should not be taking. In this video, we're going to cover a few supplements that I mostly recommend, when I might recommend them, and why it might be harmful to take too many vitamins and minerals. But it's very important that you consult your doctor and a local registered dietitian for individualized advice about what supplements, vitamins, and minerals might be helpful for you. This is just a general overview of what I see most often and why some things might be recommended and why some things might not be. So here we go. The top things that I do recommend or see most often that clients might need would be a vitamin D supplement, a B12 supplement, or an iron supplement. But I don't just recommend these to anybody, but it might be something that they have dietary restrictions. Maybe they are a vegetarian or a vegan. Maybe they don't like fish, where you would find vitamin D, or maybe it's the winter time, or they don't often go outdoors and they might also need vitamin D. Maybe they also got some recent blood work showing them that they are low in iron and vitamin D. A few other things that I commonly see as supplements would be fish oil or omega-3 fatty acids. This might be recommended by a doctor if you have higher cholesterol levels in order to bring those down or just to balance out an abnormal fatty acid profile. But there is a danger in taking too many supplements. Overdosing in supplements also have a bunch of different side effects. They're different based on which vitamin or mineral you might be overdoing or getting too much of, but there can be harmful things that happen because of this. For instance, vitamin D in too high amounts over a long period of time might cause calcification of your joints. You might start feeling achiness in your joints, kind of like an arthritis type pain, which could be due to an overdose in vitamin D. They're also maybe thinking that there could be a link between overdosing in vitamin D and potential for heart disease because of the calcification of the vessels as well. And some people think that they might need a prenatal vitamin, even if they aren't pregnant. This is a common thing that women or girls might do in order to increase the health of their hair, skin, and nails. And these vitamins and minerals are found in much higher amounts than they typically would be needed in someone who is not pregnant. For example, folate would be one in a prenatal vitamin that is a little bit higher than you might get in your normal life if you're still eating regular food. And that can be potentially linked to cancer, they're thinking as well. Although the research studies are still inconclusive, they are seeing a potential link there. Just another reason that you should not be overdoing supplements and vitamins and minerals for no reason at all. Look to your doctor, look to a local registered dietitian, and your lab work to be able to figure out what supplements, vitamins, and minerals might be right for you. And a good way to increase the health of your hair, skin, and nails without doing supplements like prenatal vitamins would be consuming collagen peptides, making sure you're getting enough protein as well. Also, the American Institute of Cancer Research puts out guidelines in order to prevent cancer and just promote an overall healthy lifestyle. One of their recommendations is actually not to take supplements to prevent against cancer, because as we know, some of these can have harmful side effects and might even be linked to an increase in incidence for things like heart disease or cancer risk. So it's very important that you get a proper assessment of yourself with a doctor or a registered dietitian to find out what is best for you. In summary, if you're consuming an overall balanced diet with no dietary restrictions, you're consuming meat and fruit and vegetables and all of the good things, then you should not really need a supplement of any kind. But if you choose to take one, consult with a doctor and a local registered dietitian to find out if it's harmful for you or if it's actually necessary at all so that you're not wasting your money. I hope this was helpful for you to give an overview of what kind of vitamins, minerals, and supplements I typically see or are common that I might recommend, but also would warn you against taking too many supplements as well. A good solution might be to take a good multivitamin that would get you covered in all the bases without getting you too much. But be careful against supplementing with specific nutrients unless you've been told to do so by a medical professional. Be sure to hit like on this video if it was helpful for you and to share this video with your friends. As always, I can be found on Instagram at @generalwellness, so you can see the day-to-day of what I do and eat.